Hey everybody, welcome to Meddkit's Provider Spotlight, where every week we are coming here with someone new to meet, a new perspective, a new provider, and most importantly, new information. Every week I feel like we have something new to share, something exciting, and it's always a good time to learn. And so this week, we have an awesome special guest for you. We have Dr. Heather Rowlands. She is the owner of Ember Dental Arts in Conshohocken, Pennsylvania. Well, welcome, Dr. Heather. Thank you so much for joining us.
Yeah, thank you for having me, Rachel. I'm excited to talk with you.
I know. I'm super excited to dive in. Want to hear a little bit more, about what you do, how you do it, what makes you totally different. But I always really enjoy secretly the origin story. I always am inspired to hear from others, what decided to, what got you here? What made you decide to open a private practice, So why don't you dive in and give us your story? I'd love to hear it.
Sure. Dentistry is kind of unique in that you're combining art and science and engineering and medicine all into one thing.
Yeah.
So you're improving people's well-being and your quality of life, but you're also getting to make people feel pretty and you're getting to do things that are artistic and things like that. So intellectually, that's why I love dentistry as a whole. And I knew when I was in school that I would want to have my own practice someday because I know myself, I'm pretty picky and I know exactly how I want to do things. I was lucky enough between undergrad and dental school to work for a really awesome periodontist up in Rochester who spent a lot of extra time mentoring me in a lot of the aspects of what we call soft skills, like how to talk with patients, treatment planning. And what I think is most important really is translating that dental language into normal person language. Honestly, we say a lot of really crazy stuff sometimes. And if you can't translate for the average person, then they have no idea what's going on.
Right.
And that's probably the most important part is make sure they know what you're telling them. So I think working at that really nice office, as well as working for my father-in-law a little bit as well before I was in dental school, kind of set my expectations for the average dental office really high. I kind of thought like all of the offices were super well run, very ethical, and really fit into what they told me in the school as well, that patient care was the most important part. And then I moved to Pennsylvania after graduation, and I discovered that in this state, you don't have to be a dentist to own a dental practice. Yeah, I was in New York for most of undergrad and dental school, which they have a lot more legislation, I guess, in New York State compared to Pennsylvania when it comes to those kinds of things. So I worked at 5 or 6 different jobs in a year, the first year and a half or so I was out of school. And at every single one of those jobs, I ended up being pressured to perform treatment that I didn't really think was ethical. There's a lot of over treatment, trying to do treatment as fast as possible to make as much money as fast as possible, and being told to change my treatment plans to people who had no clinical background. Frankly, I got pretty mad about it, honestly. I was angry and I was like, kind of like, well, if they can do it, so can I. So I started looking into it about 4 years earlier than I planned initially. So within that first year out of dental school, I was looking into what it took to either buy or to do a startup practice. And I like to do things the hard way. So I went startup because I know I'm picky. I wanted to make sure my systems were in place properly. And I had that experience doing, insurance billing, treatment coordinating, and assisting. So I knew how I wanted things to be set up. Um, you know, when I opened us about it was actually a year, a week ago, which is exciting. But when we opened, I wanted us to have a space where patients really felt valued and cared for, an environment where they were not really just like a number in a busy practice with lots of people coming in and out, but it was more like about personalized care and being able to spend that time to explain what's going on with people. I think there's a good quote from a book called Unreasonable Hospitality by Will Guidara. I'm not sure if you've read it or not.
It's
Uh,
amazing. I'm excited to
but
hear.
it's a really good book. I recommend it for anybody who works in anything even remotely customer service adjacent. It's basically about the story of how they created the number one restaurant in the world. I think it was the one on Madison Square Park. But there's a quote
Oh,
that I've always found resonates with me.
yes.
That's people forget what you do, and they'll forget what you said, but they won't forget how you made them feel. And that's like what we're really trying to do is make sure that even though the dentist office sucks, we won't want you to feel like that while you're here. We want it to be as pleasant as possible.
I love that. One, I'm super excited to read that book. One, I love Michelin guides, so I know exactly the restaurant that you're talking about. It is amazing, so I will have to check it out. But yes, people. you definitely you can remember how someone made you feel. You maybe don't remember what was said in that circumstance, but you know how you felt coming out of that interaction, good or bad, or you just never want
Exactly.
to go back. And it's so funny that we're sitting here today because I just had a conversation with someone that, due to insurance changes, had to go to a different dentist and um, came never had anything wrong prior with her teeth. And then she said that she had like five cavities, and that made her, sound the alarm a little bit. What's going on here? And so she's going back to her old dentist, regardless to make sure that she's has proper care and just to get that second opinion. But yeah, it's unfortunate that there's some bad bananas, I think, in every industry, right? And hopefully it just doesn't ruin it for the bunch. And this is why, we're here doing these interviews to get the right kind of information out there, to know what's real, debunk some myths in between, which we'll get to today. But it's so awesome to hear what you have built and doing it the right way, even though it's the harder path sometimes. And working with private practices, we know the uphill battle. But then also, we love hearing the rewards and working with the right people, seeing the right patients, and helping them on their journey is so rewarding. And so, kind of in that journey and working with your patients, I'd love to know from you, what do you feel like is the biggest struggle? What are people commonly coming in with? What are the main issues with what you see today?
Yeah, I feel like obviously we're dental practice, so everybody tends to
Mhm.
come in with a normal dental concern, like tooth
Sure.
pain or sensitivity or a hard time eating. Obviously, like we treat everything as a general practice. I really enjoy being able to kind of work with everything from gum disease to more complex restoration because I can really start from the foundation and make sure that everything that we build is really well done.
Yeah.
I try to take around 100 hours a year or so of continuing education just so I can make sure I know what's happening in dentistry and that I'm on top of things there. But, outside of just like the normal tooth complaints, there are a lot of people who are coming in asking about, just enhancements for smile appearance, things like veneers or composite overmolding that we would consider to be more cosmetic. And usually what we find is the reason that they want those cosmetic treatments is because there is some kind of underlying issue going on. Their teeth are shortening because they're grinding, because they have sleep apnea, or something to that effect. So all of it tends to be really well interlinked, and it makes my job really fun. Every single patient's almost like a new mystery for me to kind of unpack.
That's awesome. I always find when people tell me about, what are some of the chief complaints, what people are doing, there's always so much more that meets the eye. One thing leads to another thing or is connected by some really interesting way. And so I always tell people to ask questions, be thoughtful about your healthcare. So I love, that you have connected some of those pieces, especially the sleep apnea. There's some things that people just don't think about when they think about sleep apnea and how that could be related to your oral health. So, um,
Mhm.
really interesting there. But would love to also learn, you touched on it a little bit, but I'd love to know more about how your approach is different. How what you do makes your practice unique.
Yeah, so I think one of the things, I mean, like you're a woman, you've probably been to the doctor before and had them kind of just say, oh, it's because of like your cycle or it's because you need to lose weight, things like that to you. So I think that's one thing that makes it unique is I'm a female provider. Not so much here in Conshohocken, but at the other location I previously worked at in central Pennsylvania, which is like a little bit more rural. A lot of the patients would be, women in their 70s and 80s saying that they've never had a female doctor before. And we
Really?
figured out that they were having like other autoimmune problems because of things we were seeing because I was able to kind of just sit and listen to what they were saying.
Mhm.
Um, that's not the only thing that makes me unique, obviously, but it's one that I see a lot of because a lot of patients will come in and say, I wanted a female provider specifically for that reason. So
That
it's
is
studied
amazing.
in medicine too, just like doctors ignoring females' pain. So I recommend looking into that if you're interested.
Yeah, something that we talk about kind of frequently on this is just medical gaslighting on the show. There's, and I love the people that come on here because they're so into their patient care. They ask all the questions. They want to hear about their daily life because somewhere in between some little detail about their daily life could be the reason why they're experiencing certain symptoms. And if they didn't learn about who they are, where they're from, what habits they have, they maybe never would have figured out the root cause to begin with. So I think it's really important to have that relationship, and that is what makes people unique. And to have that relationship, to be that partner with that person, to be trusted, is a really huge flex when it comes to healthcare. I think, again, something that you had mentioned in the beginning, you didn't want to just see people as a number, and you haven't. You wanted to create an inviting space where people can share and then get help. So I think that is amazing. Something that I love, though, I want to dive into this a little bit. So I mentioned misconceptions. I kind of dropped that word in, which I love because there's so many in healthcare, and it is, industry wide. And there's a lot of confusing stuff going on because you have ChatGPT, you have WebMD. I guess maybe I'm aging myself. Maybe people don't check WebMD anymore, but
They still do.
they still do. Okay. So, there's all these different outlets, which, it's great that people are using the internet to find things out about their health. That means, okay, they're invested, but for you, you must get a lot of questions, and maybe some of them all not great or just all not that truthful to what is going on with the patient. So, what are the common misconceptions for you? What do you feel like you are just constantly debugging?
Yeah, I think TikTok is a blessing and a curse. I'm sure you've heard other people say that as well. It's a great way to get information out there about things you may never have heard of before. But
Yeah.
then the first time you see it, you're like, oh, that kind of sounds like me. And then it will echo it back to you about 1,000 more times. So now, at the end of the day, you're convinced you have all of these problems happening. And you see that with dentistry too. I've had people come in with some very interesting things I had never heard of before,
Mhm.
that someone on TikTok kind of just said. And now suddenly they're seeing it everywhere and they're convinced that they should be using this special mouth rinse that this person told them to buy because it's going to reverse their decay or it's going to get rid of this thing that they don't even have and things like that. As a dentist in general, I think the general kind of vibe people have about dentistry is like, I don't like the dentist. It's a scary place to be. And they're just there to like fix things after they go wrong. Whereas in reality, I would say almost everything that we do, even stuff that looks like it's reactive, is preventative. Um, your whole mouth is connected, right? Every single tooth affects the others because of how much pressure your bite puts on them. So if your bite is misaligned, or if you lose a single tooth in the back, a lot of the times you'll start to see the other teeth start to take the stress of those different things. And then they also start to break down as well. So if we're saying, hey, I know you're not really having a problem chewing, but you're missing that molar, and maybe not right now, but 10, 20 years from now, your other teeth may start to tip or to crack because of just the pressure of your bite on them. We're not trying to just be reactive and fill the hole just because.
Yeah.
Everything kind of just becomes preventative over time.
That
Uh,
makes a lot of sense. I like that approach. And I think a lot of people maybe don't get the full explanation. They might just be hearing the end result and not really understanding the why and then freak out about it, right? So I really like that approach.
Or it's like, if it doesn't hurt, why am I doing something about this? Because they just like don't understand that teeth don't feel pain the same way everything else does in your body.
Yeah.
There's just they only really feel like pressure and temperature. So by the time you're feeling pain in that tooth, either the cavity is big enough that now you've got bacteria and stuff going into the nerves directly to make it feel sensitive to cold, or if you're at that full like really bad toothache stage, now the nerve is either dead or dying because it's fully infected. So, it doesn't hurt. I don't want to fix it, but also like if we just do this filling now, it stops you from that root canal later.
Yeah, I always say you don't have to wait until things are like a brick through your glass window, and it can be like, oh, okay, like I need to repair the door and put a new knob on it before like the whole door comes. It's just like there's just things that can be done that will prevent larger things and save you money in the long haul. And just the distress and, you know, the anxiety that goes with it. And then it's not so bad?
Exactly.
I love it. Really good things to debunk. I think a lot of people think about them, in terms of dentistry. But it's really nice to just come on here and set the record straight. We're not scary people. We're not trying to, do anything that's crazy, but it is actually for preventative health. And you'll be thankful later on, if you do them. So, kind of rounding out today and getting some more tips. You've thrown out a bunch already, but something that I love to do is get pro tips for practitioners, but then also the normal everyday people, just like us. So for practitioners, you have started this ground up. So many people are also in your position and they're maybe banging their head against the wall. What do I do? Or, I'm stuck on something. I would love to know a pro tip from you on something that you do maybe every day in your practice or something that you can't live without, that has really helped you along in this journey. And then any pro tips for everyday people that would turn their oral health upside down in a great way. So would love to hear all the tips for all the people watching.
Sure. For the providers starting their practice, I would say you're going to kind of become everything and don't shy away from that because there's a lot, especially in dentistry, there's a company for everything and they'll convince you that you have to use them for everything. But if you don't understand what they're talking about to you, then you won't know if they're doing it wrong. Um, like in my example, I had a one marketing company that I worked with, and I didn't understand what any of the marketing terminology meant at that point. And it ended up just being a very bad fit for my practice and being a large waste of money for us. Versus now, almost a year later, I've spent a lot of time on YouTube or on free videos from universities and things, just like learning more about marketing. So now I can have a conversation with our new company and ask them, why do these statistics look this way? What do we need to change with this? Are we waiting long enough for this? And they really enjoy that we're actually able to discuss things productively. So make sure you actually understand what's happening. And I would also say make sure you work in a dental practice in any of the other positions besides being a dentist. It's hard to do that once you're already a dentist and you've decided to do this, but even just like hang out with the front office where you've worked before for a day and just see what it's like. And try to make sure you have a good, solid understanding of how the admin portions of the office work, including insurance billing. That's like a big one, as well as what it looks like to be an assistant for a day. How do you run the sterilization? How are you going to do things if your assistants all call out sick because they all have the flu at the same time? How do you schedule if you don't understand how long things take? And you'd be surprised by how many dentists and how many of like the vendors I talk to who are shocked that I previously used to do treatment coordination and I understand how to do insurance billing and things like that. They think it's incredible that I can tell them what the code is for something, which I feel like should be the bare minimum for an owner. So that's my advice for the practitioners trying to start their own practice. For patients, I'd say the biggest thing in dentistry is consistency, just like any habit. Um, you know, of course, we're human. No one's going to start flossing their teeth every single day because I told them one time to do it. Like, I get that. Um, but it's more about having a set routine and making sure you're spending that time brushing and flossing, even if it's like 3 times a week, a couple times a week, that kind of thing. Just doing something on a regular routine to help prevent that cavity from forming in the first place. We're told to avoid sugar. Sugar is not really the real reason we get decay. It's more of a combination of acid and bacteria breaking down the teeth slowly over time and making them softer. So every time you put food in your mouth, it's acidic and your teeth become a lot more susceptible to decay. Um, so if you're snacking slowly throughout the day on like a bunch of carby stuff that sticks to your teeth, you're gonna have a much higher risk than if you're only eating at meal times and things like that. So like I said, it's more habits than anything.
I love that. See, you just debunked another myth. There's so many, they talk about the Halloween candy and all that. Yeah, but yes,
Mhm.
in a way, yes, I get it. But yes, it makes sense. You are producing acid. There's other things that are getting stuck in your teeth every single day. And yes, other reasons to beware of snacking.
Exactly.
I love it. This has been amazing. Dr. Heather, you are awesome. I so appreciate all of your insights today. Before we leave off, I would love if you could tell everyone how they can reach out to you, how they can connect with your practice.
Yeah, absolutely. So like Rachel said earlier, we're in Conshohocken in Pennsylvania. You can find us at www.emberdentalarts.com, or you can just call our office at 610-897-7838. We take texts too, and I'm always on my phone, so I'll probably answer it even if it's the weekend. So,
Sounds awesome. We really appreciate it and hope to have you on again
all right. Thanks so much, Rachel. I appreciate it.
anytime.